So we have great participation here. And I'm just going to give a quick overview of what we're going to do today. And then we can start. So this session on quantum has a focus on how can developing countries prepare for quantum technologies into the future. And this may involve some special training, definitely need to create awareness, and there may be lots of other solutions that all of you can suggest for everyone's help and use for the future. And we also want to focus a lot on sensitive groups or minority groups or disadvantaged groups. So they could be women in developing countries, they could be kids, definitely the elderly, the sick, and so forth. So if you have solutions that you can share with all of us and inspire all of us, that would be absolutely wonderful. So my name is Amali Silva-Mitchell. I am the chair of the Dynamic Coalition on Data-Driven Health Technologies, and we are the host today for this session. And so we know quantum can really help health technologies, and I in particular wish they can help technologies for the eyes, because I have poor eyes. But we know that it's going to impact everywhere. And we have already understood the security issues. So I would say perhaps leave that out a little bit in terms of security issues, but explore the other areas where quantum can help and where we need to assist the population in creating their awareness and solutions. So we're going to start off with Nicolas, and Nicolas is going to give us an overview of what quantum actually is.
Amali, if you wish, I can introduce briefly Nicolas, and then he can take the floor, okay?
Please do, yeah.
Okay, thank you everybody for joining us at this very important meeting. Nowadays, quantum computing in healthcare, as Amali already mentioned, covers a wide range of issues from drug discovery, genomics, personalized medicine, medical imaging, healthcare operations organizations, data security, and so on. And for us, it's a real privilege to have the participation of Nicolas Fiumarelli, who is one of the world leaders in this area of quantum computing for several years. He's actually based in Uruguay. He got a computer engineer degree at the university there in Montevideo, and is a software and network engineer at LACNIC, where he specializes in internet security and the resilience of critical regional infrastructure. He has been a leading figure in technical community, serving as a steering committee member of MANS, and is the current chair of Working Group 1 at the Internet Standard Security and Safety Coalition, focused on quantum and post-quantum readiness. In 2025, he was selected as an Internet Society Community Fellow, leading the formation of ISOC LAC Measurements Group. Nicolas is a frequent speaker at IGF, WISI, SICAN, and IoT security, AI, and the evolution of the digital ecosystem. He is a strong proponent of post-quantum cryptography as a vital solution for global cybersecurity, and is dedicated to addressing the complex political and governance questions that quantum technology poses for the future of the open internet. Also, I really want to mention that Nicolas has struggled for several years to help people or to motivate new professionals, students, and members of the technical community to jump into this not so new but very relevant technology, quantum computing, and also how to be able to train quantum physicists who understand the different environments that we do have in our current society, like healthcare. That means he is also striving to get more people motivated to learn about the healthcare ecosystem and how the quantum computing can impact on it. Without any further comment, it's my pleasure to give the floor to Nicolas Fiumarelli. Nicolas, please.
Thank you so much, Amado, for your kind words. Really, thank you so much. And I would like to bring 5 or 6 minutes of your time to present a little on some of the great challenges and risks that this technology and some connections with the digital health. Just to start mentioning some points, quantum applications are transforming health in different aspects, not only the cybersecurity component, as you mentioned, because quantum computers are a threat to RSA and ECDSA. Actually, there are algorithms that we use for encryption in different fields in the internet, but also in the digital, in when storing data-driven biometrics, etc., in different components. But cybersecurity is just one of the things, because obviously computational power and especially quantum, that we'll deal a little later on, that are specific for solving these complex problems that are the cryptography. I will deal a little in that, but I would like to mention and focus a little on these other things. For example, the Grover algorithm can do with chemical databases and scanning, specifically this new concept of the quantum, right? That you have here, that if we have a 0 or a 1, this is a bit, but a qubit it can be both at the same time. And this means entanglement and different properties. And especially when we need a very basic example is that if you want to order, you have two numbers and you want to find the minimum number. Even the best algorithm in classical computer, you need to go through every of the 200 numbers to get the minimum one. But with quantum computing, if you can model these numbers in a way that you can use the Grover algorithm, you just need 3 or 4 steps and don't need to go through all these numbers to find the minimum. It's a concept that is really strange, but actually is an exponential gaining in some of the kind of the problems in our world. Some of those are drug discovery and different. When you were in high school and you were dealing with chemicals, right? You need to have the oxygen and the hydrogen, and different rotations of these molecules or things can generate different kind of proteins with different properties. So mapping all these different combinations is something that with this technology in basic you can do. That also open the floor to other kind of uses of quantum, that is on precision medicine. For example, when doing quantum sensing or quantum metrology as well, you can find specific patterns in DNA or in your body that is with the instruments of observation. Also in other aspects such as ultra-precise treatment for cancer-specific organs. For example, a plan for irradiation when you don't want to affect other organs or specific molecules, so you find a better treatment with all of these combinations or different quantum level sensors. So as well, you have other specific technologies for quantum communications like quantum key distribution, but that is more for the cybersecurity part. So we have some advancements in the last years. We are hearing every week, actually, I am more reading scientific work and different, a lot of papers, daily new papers about different techniques in the theoretical and also in practical quantum computers. There are physical ones. You have some pictures there and some milestones. People say that the Q day, that is the day when the quantum computers have the sufficient gaining to be a real problem, is coming faster. So yes, on one side we have the evolution. This technology in theory is old, but well, what is new is the practical things, different like quantinuum last year. We are telling about that the quantity of physical qubits versus the quantity of logical qubits needed. And this is a problem for digital divide and global digital divide. We have one of the things that are encryptions are everywhere. These are examples of medical devices you are having in your home that are becoming more IoT, or there is a term that is IoTH, that is for the health, because you have CPAP machines, now sensors in your body or pacemakers that are connected with your hospital facilities, different things that need to be stored and need to be safe. You can attack if you have a RFID card to enter in the sensitive center in the hospital. There are several data things that depend on encryption. And encryption ensures privacy, protection, the transmission of the sensitive information in the case of biometrics. Now we are talking about age verification mechanisms in countries. These are kind of things that are crucial for keeping the data safe. More example of different artifacts, but it's not all about encryption. This is for a wider presentation I have that I explain everything about it, but you have different standardization bodies internationally that has released the first standards of post-quantum cryptography. This is nothing to do with the quantum, it's just more better classical algorithms that are better than the previous one, RSA and AES, used in the high complex of medical training data across the world that you can find. I have a picture here with the different actually brands of different new artifacts that all of them are using extremely vulnerable cryptography for these quantum computers and can be really sensitive, can be an impact that is with an unprecedented pace worldwide. This presentation has also what are the quantum resistant algorithms, but more than these algorithms in the cryptography phases that really affects not only these IoT devices and medical healthcare, but also the internet itself and the routing and the domain name system that is basically the critical infrastructure of the internet, the place we all exchange data-driven systems and medical facilities, but also about this part. And I am just finishing with the last two slides here. There are inequity. On first place, with the capacity, with actually the budgets of the governments in the world that are different, and you cannot have a quantum computer in every country in the world, or the different advancements are attained to the different evolving ecosystems of the different countries, and what happened in the university, in the research, where there are, from the global south, we always say that we have the capacity, we have maybe the possibility of giving more education on this for the future generations, but also we need to be globally equipped. For example, if you have a cancer treatment that is more specific and very advanced, and this is not false, for example, Pfizer and different very popular because of the vaccines with the COVID, but also companies, pharmaceuticals, in the rest of the world are doing specific treatments for specific cancer patients. So we have a gap, a quantum gap, because if you don't have the ability in your hospital to create the exact protein that you need, you will need to depend to other countries' technologies, and that is the part when we need to talk about equity and well a common interest. Like I always want to finish mentioning the multi-stakeholder ability. We have youth IGFs around the world. For example, in my country, use IGF Uruguay and the Internet Governance Forum. And we are gaining more momentum with the youth learning about these technologies. We also, the work of the Internet Society chapters worldwide trying to came with these new topics that really affects not only the Internet, but the Internet is connected with everything in our lives, as well as other quantum groups with the industry and different sectors in the groups that it's a good experience to have this multidisciplinary, because it's a multifaceted field. And yes, there is a lot to work about. And I am very happy that we at the United Nations and the Internet Governance Forum level, we are dealing with these matters, because this is an emergent technology that is no more emergent than, I would say, not more theoretical. That is why we need to work all together and try to be at the pace, not on the educational field only, but also about the possible regulation and that. Thank you so much for the time, Amali, and I think that will be helpful for more interest and also to create more interest for this new youth IGF and around there and the intersectional work that is happening. I think we definitely need to be talking about this year. Thank you.
Thank you so much, Nicolas. That was just fantastic overview for us. And I want to focus on use the word inequity, and that's exactly what is inequity and how can we get to fairness. And Amado, thank you very much for introducing Nicolas, who has a fantastic experience background. So how we're going to proceed is going to be a little bit different. Today I was going to have Miss Jenny Sicat, but I'm asking her to please wait a little bit. We're going to have Oscar Garcia, as humanity has just gone around the moon. Oscar is working on digital medical records for the moon. So Oscar, I'm going to give you the floor for a couple of minutes. If you can just maybe give us a little bit of background, who you are and what you're doing, and give us a little bit, and then after you, we'll move to Jenny. Thank you so much.
Hello, Amali. Hello, everyone. I was invited by Amali to this meeting. I've been in the medical record system for 25 years. We have been awarded by the World Summit of Information Society years ago because of our development. I've also been in the IPNC, Interplanetary Chapter of the Internet Society, as the driver and brand of the pilot projects working group, working with persons like Vital Surf that you all know. And recently, last year, we tested with my team from Digital Health, we tested our application in space while flying to the moon with the Athena spacecraft that was launched on the year before in 2025 in February to the moon, and we made good communication. We exchanged medical records between a spacecraft that was flying to the moon and Earth, between a consultation that was made by an astronaut to a doctor on Earth. We use technologies derived from my experience in default delay and disruption tolerant networking, and technology that I developed myself to keep track of the medical records and the response from the doctor on Earth and back to the spacecraft and to the moon eventually. And well, we were very happy that it was successful, published in the media, and it was overseen also by Vinton Surf and with the company that is Lone Star, that they set up, Lone Star Data Solutions, that they set up a small data center on the Athena spacecraft. And we were invited to make this experience that it was the first time that this kind of thing has been done. And we were very happy that it worked pretty well. And now we are working in a second version of the technology, also with artificial intelligence, and to be set up in a spacecraft to fly to space, because it's the next frontier that as humanity we have.
Oscar, can you tell us a little bit, how do you think quantum technology will support the work that you're doing, please?
We have to understand something. When you're running a space, the technologies that are used for communications and deployments had certain differences, specifically with the technology that we use on Earth, because we have this change on that a bit, because one of the big problems here is distance and speed. And in space, everything is moving. Things are not well used, that things are stabilized and in specific places. And in space, things are moving. And one of the technologies that we use all the time and is calculation of where is a certain spacecraft, a certain computer that is running a spacecraft, and that is on a planet, or could be an asteroid or the moon, or a satellite. And the technologies like quantum computing that at this point need an infrastructure to develop will be very useful to have on Earth. But in the future, it's very possible that we can have that running on space. We are talking about data centers in space that was just an idea years ago. And to make these very specific calculations that need accuracy and speed, and it's something that is one of the biggest problems, to be precise in the determination of communication and exchange of information in space. I'm sure there are many other uses that are going to happen, but that's something that I've been thinking about for some time.
Thank you so much, Oscar. That's wonderful for us to see and hear about what's happening. I know I was avidly watching the whole process on CNN. And you talked about DTN, and we're talking about, we've had this internal communications with our group about that deficits there are when you change over from speaking from space, from speaking from Houston. I'm hoping quantum will help all this streamlining of all these activities. So thank you so much for joining us. And now
I appreciate your invitation. Thank you.
Thank you. I'm going to pass this on to Jenny Sicat. Jenny is specializing in women's issues, but she's also got a background in investment banking on Wall Street. So I'm going to let Jenny speak for herself here. Thank you, Jenny.
Thank you so much, Amali. Thanks for the invitation to come and speak here. As Amali said, I did come from Wall Street, and I was actually part of the early movements in fintech. I used to create valuation models for the use of banks. And then afterwards, when I was on Wall Street, I actually was at the forefront of innovation there, financial innovation. So I did a lot of the structural products for JP Morgan at the time. So I love anything innovative in tech, but also now have a background in dealing with the impact on women. I've been an attendant to the UN Annual Commission on the Status of Women meetings. And so what I'm going to share today, some of the actual data and observations from there. So Amali, if it's okay, I might spend more than 2 minutes on this just to share everything. Okay,
sure.
right. Yeah,
And
thank
I
you.
just
Yeah.
want to add that Jenny has been actively working with women's group through COVID, getting
Right.
women skilled up to use technology, which is wonderful in North America. Thank you.
Yeah, so actually, I do have a lot of examples as we're going through. And we are at a pivotal point in human history. As you've all described, we've been to the moon and back. We've seen things that no human has ever seen before. And really, these technologies are so powerful and they have the potential to benefit all of society. But they also present us with enormous risks. And what is important to realize, I think, is that our technologies mirror our societies. The way we design them and the way we deploy them really echo our values, but also our biases. So if we want broad-based benefits to society, as well as mitigation in all of the risks involved, we need to have a lot more diverse opinions and contributions. So this is why the involvement of women is so critical in this, especially for the safe and ethical and responsible use of the technologies. So let's focus a little bit on tech itself before I talk about the larger world. So in tech, according to the Bureau of Labor Statistics in the US, only 28% of employees in STEM are women. Now, that's an improvement from 8% back in 1970, but still, it's not up to parity, which we see in other fields. Now, when you look at the frontier technologies, for example, in AI, the numbers are even smaller. So a global study showed that there's only about 12% of women in the AI field. We're talking academics here. And then with quantum computing, I reached out to my graduate school. Bristol University in the UK is at the forefront of quantum as well as supercomputing in the UK. And they said that they have 3 women professors out of their team of 17 specialists. So you can just see how small the contribution right now of women are. And then it's important to ask about the real lived experience. So I reached out to my friends in Silicon Valley and all that. And one of my good friends, she's been with Google as a niche software engineer. And she said that after 20 plus years, she is still the only woman in the room at most of the meetings. She has 2 daughters, both of them are in engineering, and they have the same experience. One even quantified it as 13% girls in their engineering program. I reached out to another friend in tech in Australia to get a different picture, and she's in tech. She has a daughter in robotics. So we're already talking about the next generation here. And the daughter said that there were 3 women out of about 40 to 50 in mechatronic engineering. So you can just see how small the numbers are in these frontier fields. And you wonder what's going on here. And there was a survey by Women Tech Network, and they found that there is a bro culture in this frontier tech world. 64% of respondents said that they were spoken over during the meetings. And 19% said that they were pigeonholed in stereotypes, like being asked to take the meeting minutes or even being asked to get the food for the meetings. So you can just imagine this is not a very encouraging workplace for women right now. And why does it matter? We already talked about AI, where the development of the model affects the outcome and also the intrinsic biases that are built into it. Had there been more women involved at the beginning of this, we probably would have been saved a lot of the scary news that we have now. So you can just imagine, now that we know what we know, what about training AI to be protective of human life, protective of the environment, protective of our cultures, and so on and so forth, so that we take away all these scary outcomes. There's also another important thing to note, which is that boys and girls, and I'm talking adolescents and teenagers here, boys and girls have a very different experience in the digital world. Among users of the internet, perhaps one of the most pressing issues is cyber violence. So we're talking online harassment, cyberbullying, even human trafficking online, and with AI, the deep fakes that basically take use of images that are taken non-consensually and created. And these 90% of deep fakes are pornographic in content. And 99% of those depict women, usually with images that were just taken without their consent. So you can just imagine the ramifications for young women. We're talking girls here. They're really deep. There's lifetime mental health issues. There's isolation, not just in the digital world, but in the physical world. And we have to remember that everything that happens online usually progresses to the physical real world. There's lost job opportunities because these deep fake images get spread. And then in the worst cases, we have death by suicide or femicide because online stalking usually progresses into the real world. So this is the backdrop that we've got right now in the STEM field. But let's take a quick look and see what girls can actually contribute when they are in the field. Probably one of the biggest examples many of you are probably aware of is Amanda Askell. She's the philosopher for Anthropic, one of the leading AI firms. So basically her job is to teach AI and train AI to have ethical values, to have good character traits and that sort of thing. So that is really major, I think. And there's a lot more women getting involved in this. Another example, a survivor of cyberbullying, Trisha Prabhu, and she created an award-winning app called Rethink. And it detects hate language in a post and basically actively engages the user to reconsider their post before disseminating it into the wider public. And another example, which is probably not as known, as there are a lot of nonprofits out there supporting young girls to get involved in STEM. So Girls Who Code is an after-school club for girls in the 3rd grade all the way to 12th grade. And they just released last week the results of an AI cybersecurity contest that they had. The results were amazing. So in one case, a middle school girl, created an AI-powered tool to detect deepfakes and scams, verifying who the user is interacting with. So that's great. This is just a middle schooler. And another student built an AI voice shield to verify real identities behind the deepfakes in real time. So just a couple of examples here. On the user end of it, another survivor of cyberbullying, and this was all over the Commission on the Status of Women meetings that I was at. In Mexico, she was a survivor and she led the landmark model law that basically codifies cyber violence as a crime. So now there is a set of legal consequences when these things happen. So it's a model law because now it's affecting other governments and they're thinking about how to implement it in their own spheres. I've talked to Amali about this before. There are actually other nonprofits out there in places like Afghanistan and Pakistan, for example. They teach young girls how to code. And what's amazing is that it was very successful. Girls did not have to leave home in unsafe environments, especially there where you really needed to be accompanied by a male or that sort of thing. So they didn't have to leave home to do their programming work. 2, they were earning more than the men in the family. And so the families were very supportive of this effort. But 3rd, and perhaps in my mind is really important, is that these young girls were empowered. They were empowered not just economically, but also socially and emotionally. Let me turn to the user end of it. We talked about COVID and the impact on the world. There was a study during COVID by the International Trade Commission, and they found that 1/3 of women-owned businesses pivoted to online sales versus 11% of men-owned businesses. So here's a real example that put food on the table for families during the pandemic. So essentially, the point I'm trying to make is that when women are involved, everybody gains. And perhaps one of the most succinct statements from that was from the Nordic Council of Women during the CSW meetings that I attended. And the Nordics have had a long, hard-fought history with gender equality. And they basically said that economic success in the Nordic region, the Nordic countries boils down to one thing: gender equality. Supporting women at work is good business. It's good economics. It helps the entire family. The pie is larger, well-being is supported, and the entire society benefits. And we've seen that as well in examples from the World Bank and the IFC, where they found in microfinance, you give a loan, a micro loan to a woman, it benefits not just her, but her family, and in many cases, the entire community. So those are just a few examples there, but let's talk about the digital divide and global connectivity. And there really is still a global gap, as was mentioned by Nicolas before. There are 2 billion people in the world who still do not have the internet. The majority of them are in the global south, and the majority of them are women. The gender digital divide has narrowed, but it still exists. And in low to middle income countries, at least 66% of women now have access to the internet. 60% of women in these low to middle income countries now own a smartphone, which is where you usually get access to the internet, versus 69% of men. But the barrier still exists. Financial affordability for devices is definitely key, and there's still low literacy in digital skills and pervasive social norms, prioritizing access to the males in the family. But one nice example that I'm really excited about was the APEC meetings, the Asia Pacific Economic Cooperation meetings last year said that the Philippines did not have a gender digital divide. I'm excited because I'm Filipino, but US naturalized. And what they found here, and this is transferable to other countries, what they found was that the Philippine Department of Statistics actually made an effort to get gender-specific measurements. And I think this is key to any problem. You have to ask the question, then you have to try and get the data, and then you can try and figure out a solution. So because of that, the Philippines has had many programs to increase access, including providing free Wi-Fi in cities, and also they were able to address training programs for women in particular. Other governments we know also have made big pushes into using the digital advantages that we have. China, we know very well, has made a big push towards AI. And one of the interesting points that they made was that they are getting the women in rural areas, for example, and they're using them as trainers of AI. These are underemployed women in the rural areas, and now they're part of the AI training camps. There are a lot more efforts in many other countries too to provide digital tools for women to get access to social services as well as access to justice. But again, I guess before I leave, we still have these enormous questions. Cybersecurity, big issue, especially with the advent of quantum, even though there are all these benefits that we're hoping for. And with AI, privacy and use of data, it's still a really big issue. And then another one that many people don't talk about, but I'm actually quite worried about, is data pollution, meaning the responses of AI end up going back in the feedback loop, and that ends up polluting our knowledge base. I think this is really key. And anyway, we can talk about this later, but there's so many issues out there. And I think the main thing is let's throw our best minds on the planet to figure this out. So not just half of the planet, but all of the planet. So let's get the women involved, right? They're out there and they can contribute great things. We just need to make it accessible to them. So just, I guess as a final note, technology mirrors our society and it amplifies our values as well as our biases. So we really need to have women more involved and make sure that this is equitable to all. And as we think about the next generation, because we're seeing everything fall through, right? Let's encourage the next generation to keep developing their critical thinking and building a solid ethical and compassionate worldview. I think this is so key right now. And how do you do that? It's really through fostering deep human relationships, especially in a world that is frequently now becoming so digital. We need to keep this up. So hopefully with that, we make this a great opportunity for everyone. Thank you.
Thank you, Jenny, for that extensive, very thorough analysis. I just want to add something on behalf of women. I think a number of women are being left out. And I can remember I was only 5% of my master's in IT class. I think it's very important to encourage little children from the time they are very young, toddlers. I got a little bus, I can remember, not a doll. That was my first present that someone gave me. And that really drove me into technology, without a doubt. It wasn't a doll, it was a little bus. And I think we must really look at grandchildren or nieces and nephews. You're giving them little presents. You want to encourage them right from the very young age to get into technology. And that is absolutely important. That's what I see. Now, I'm going to give this to Amado. Amado is my vice chair with João. Would you like to share a few words, Amado, or are you good from what you've said? Others will give it to João.
Thank you very much. I think it has been a really exciting participation and challenging as well, because we do have too much to do, not only in terms of the gender divide, but also in terms of the physical capabilities of the different countries in order to approach this new technology. Probably my final comment will be in the direction of something which is right now a very hot issue, and it is the one related to the post-quantum cybersecurity, in which Nicolas has also participated in different fora. Yeah, Nicolas, do you have a couple of words to share with us? What's in the agenda for 2036 and what is expected from the standpoint of the healthcare systems to adjust? Thank you.
Something interesting to mention is that the FDA is going to not allow any more devices that are not quantum resistant, for example, because they can be adulterated when this technology. It was a global thing that I heard really soon. But yes, you must be aware of every week in this field, because it's evolving very rapidly. And yes, things can be based now in how much money businesses will lose if not migrating to post-quantum cryptography. That is definitely one of the things. But yes, on the global digital divide, and I am really hearing all your thoughts. It's really great to illuminate on this. In the chat, I put some things on this multifaceted global divide because of these technologies, not only the affectation of private data, that is a very high topic, but at the same time, as with AI, it's an emergent technology that will transform everything. Thank you.
Thank you, Nicolas. Thank you, Amado. I want to ask now, Rodrigo, would you like to share some words and perhaps a different perspective as well with us?
Hello, Amali. Hello, everyone. Yes, happy to do so. I would like to give a little introduction about myself. So I'm a health scientist, and I perform and I work on the implementation of digital health solutions, especially AI and VR training technologies. And I'm also an LGBTQ plus advocate. So in this context, I would like to place the attention on how can we speak about quantum divide in healthcare training, but also with the focus on LGBTQ plus community. So we understand that wealthy nations have the access to quantum enhanced AI and VR first. But what happened with under-researched countries where marginalized groups like the LGBTQ plus, healthcare workers and patients face extra barriers like lower digital access, harassment in online training spaces, bias algorithms that overlook the diversity needs. What is the sensitivity culturally to address these subjects? A couple of ciphers before I place a question for the group, but according to the Forbidden Colors 2024 report, AI on LGBTQ+, the AI exacerbate bias, as we know, but for instance, the trans flag as anomalies in scanners. Automated moderation disproportionately censors queer content, for example, gays or lesbian demonetized videos. So this is happening, this is real, and for us, for the community, is meeting us on an everyday basis. So the question is, how might quantum technologies widen the global digital divide, and what policies could ensure inclusive access, safety, and digital literacy for marginalized groups such as LGBTQ plus communities, for example, in AI or VR healthcare training technologies? If anybody would like to join and give their comments about it.
Do you think, Rodrigo, that QT will help perhaps with, algorithms that instantaneously perhaps reduce abuse and stuff like that? Do you think there are these opportunities that we can use? And I guess we have to push forward, right, to make sure that they happen. That's getting rid of the biases. Jenny also mentioned the biases as well. And I'm just wondering if the speed of quantum precisely used can help society deal with reducing those biases? What are your thoughts?
I can imagine that it's also very similar to what it is happening with the use of AI. So the basic AI models that we have so far, the data we put in is the data that is going to be using for the results and the output of the models. So whenever we bring forward the conversation and the data it's including and addressing the bias for the LGBTQ community, there is a big opportunity to correct or prevent this to grow in the wrong direction. And this is when the interdisciplinary teams and the different stakeholders should communicate with each other to understand the different perspectives in this regard.
So that's great. So I think as a group in data-driven health technologies, we can really support this issue of data pollution that Jenny mentioned, and cleaning up the data that goes into systems that are going to get embedded. And right from the beginning, I was terrified of data being there and then all of a sudden drawn out in an adverse manner. So that's something we can talk about in the future, and we can possibly focus on for another event on this factor of data pollution, which both you and Jenny had talked about, and how quantum can perhaps help. Now, thank you, Rodrigo. So I'm going to ask now João, who has wonderfully set up this whole session for us. João, would you like to provide some comments for us, please?
Thank you very much, Amali. Thank you, everybody. Before I jump into that, I think my thought will be a bit transversal, including both the quantum and AI. I think Nicolas and Dr. Oscar and also Rodrigo, they've already tackled some of the key elements I would have mentioned. Even Chen also mentioned those elements. Before I start, I would say that I'm also, as you mentioned, part of the TENEMI Coalition Data-Driven Health Technology, and my main focus is about digital health, data governance, and also AI systems. So in terms of perspective from quantum computing and also intelligence artificial and in healthcare, I would say not only from technical standpoint, but also from the governance and societal perspective about those edge cutting-edge technologies. Firstly, about artificial intelligences, like we know now it's already transforming our society and also transforming healthcare systems from diagnostics to decision supports. But however, these systems are also not only as good, but also the data they use and they are trained on to raise critical bias issues. Like Rodrigo mentioned also some of the everyday life biases that are transport directly to the AI model that are built. So many AI systems today are trained on datasets that are underrepresented population from the global south, for example. So as a result, these systems risk reinforcing existing biases for marginalized group and also existing health inequality rather than reducing them in the end. So the way we provide and develop those models should take into account those elements. So the question is not only about how accurate the AI model when we're talking about artificial intelligence, but from whom is it accurate for? And then when we're talking about quantum computing, taking into account what we always heard from Nicolas and all the other speakers, that quantum computing introduced both, of course, a huge opportunity, but also a risk. And in that regard, I think on the opportunity side, there are solutions today that are available. For example, quantum computing cutting-edge technology are being used to explore drug discovery and molecular simulation, for example, with big actors. I don't want to name those big actors now, but they're working on accelerating complex biomedical research. Those are real-world examples existing today on the web we can search for. But also in the risk side, the quantum computing is of fundamentally, I would say, challenging current algorithm system, and the algorithm break widely and use cryptography systems such as the RSA. And these particularly concerned in the healthcare system where the data have a very long lifespan, which allow, for example, to have access to those data because those data are saved longer so they can use some scrapping mechanism and sophisticated mechanism to exploit those data, and then later on work on using the exploit they are already discovered. So we already seen concrete examples from, for example, those big players like Apple, and I didn't want to mention them anyway, but recently they introduced post-quantum encryption in the messaging app, for example, using a Crabbe algorithm. And this specifically anticipate future quantum threats. So this shows that the transition is not theoretical only, but is actually happening today. So we need to bring everybody on board, and also make sure that the health data collected that could be exposed in the future. And we need not only to define policies, but also mechanism and technological solution around those, so that when applied, we are not only going to be able to adapt to threats that we are going to face, but also be quantum risk and a cryptographic early enough ready, so that we face those risks as well. And also one thing we need to really mention is about the emphasis on cultural context. Technology does not exist like in a vacuum, and healthcare, for example, system are deeply embedded in societal and also cultural and institutional realities. So if we design AI models and digital healthcare solution without understanding these contexts, we risk building solutions that are not technically advanced but societally misaligned with the people's reality. This applies for solutions that already exist in the quantum field that are already exploited today.
João, would you like to speak? One thing I just want to give is I'm concerned about the financing for quantum. And as Nicolas mentioned, we have the great opportunities for technology in hospital, but how are you going to fund them and finance them? So that's something we all need to think about, as always, for IGF, we're thinking about funding.
Thank you for setting this up. And I think in Geneva we have the Open Quantum Institute, which is spreading knowledge about quantum to everywhere, particularly to countries where this is not already being established. And I think it's important that this knowledge is spread wide. At the same time, of course, we create problems with computers that we wouldn't have otherwise regarding encryption. Lots of things have to be done there. And I would also say quantum technology is quite a different technology than AI. And so you have to understand it to know where the specific opportunities and risks are. And they are not lying in bias, etc., but they are really being able to do things that have not been possible before, particularly breaking encryption or calculating things that were too complicated to be calculated before, too complex, and this can achieve new optimization in many cases. Quantum computing is a small scale computing. So we are talking about really small computers right now. So large language models are very far from quantum computing. This will not happen until we have a lot of advancements in quantum computing. The next step is really quantum computers that can solve particularly specific difficult questions like problems like encryption. And this is where we need action. And I think this is happening, but it's happening in a pace that might be too slow in certain areas, where data harvesting can take place already and encryption can happen later. Or if you have a qualified electronic signature, then you might not be able to rely on it for long anymore. Thank you.
I just want to highlight something you said, that right now quantum is constrained in terms of the amount of data that it can use. And that's a very good point, because we'll see that, I guess, progress over time, but it's concentrated on smaller activities. So that was wonderful. Thank you.
Yeah, so there might be quantum AI in some future, but this is really far away. This is not something that we will see unless quantum computing is available everywhere. This is not the next step. This is not the next step, but it is really far away, where other quantum applications are quite closer and might be available in the next 10 years or so.
Yes, excellent.
I was thinking during all the session about the digital divide, and one topic that I would like to remark is specifically the difference between being digital users and being digital builders or developers. When we talk about digital divide, most times we are talking about digital users. 20 years ago, nobody had a smartphone, and now there are smartphones all around the world, but there are only 2 or 3 countries that produce smartphones. And I think that's one of the big problems nowadays relating to digital divide, because the societies of the different countries don't consider that building technology is socially valuable or an economical good business, except those countries that are the builders of this technology, United States, China, and some country, but not many in Europe. And I think I'm not forgetting none of these countries. And to overcome this digital divide, not only in quantum computing, but also in artificial intelligence, in digital health, we have to find a way that the societies consider that it's important not only to be users, but only to be builders of new technologies. Otherwise, we are only clients of those really big companies, even not only in software, but also in the base technology. And I think that's something that is not in the focus, not only of the governments, but also of the societies, because otherwise we are all going to end being clients of different technologies, but we are not going to be to have deep knowledge of these technologies as nations, so as to develop and be the deep benefits that these technologies can give to our societies. That's my point.
Thank you. Thank you very much for this contribution, Mr. Dr. Osa. I think Jen wants to add a word. Please go on, Jen.
Thank you. I just wanted to follow up on Oscar's comment. I agree 100% that part of the issues that we have is that the development and design is concentrated in not just a few countries, but sometimes in a few countries, and in fact, some in terms of some individuals too. There was the very recent Global AI Summit that was held in India just a few months ago, and it's the third AI Summit, and they did try to focus a little bit on spreading it, not just in terms of usage, but also development to other middle income countries. So that was one of the main focuses. And the fact that it was held in India rather than before that, it was basically in the UK and in France where the AI summits were held, was a signal that there really should be an effort towards addressing this divide in the design as well as in the use, of course. So there were 86 countries represented there, obviously the big tech companies that were involved in AI, but some of the middle countries that were trying to find use, but not in just like end user of the internet, but more in the middle end of it, basically was quite interesting, I thought. And they ended up with a non-binding agreement, but it's a set of guidelines for safe and responsible use of AI, which hopefully is a blueprint across countries to use, countries and companies to use. Thanks.
Yes, thank you, Jenny. I saw that as well from India. It was very interesting. I'm glad because they have such a diverse community. They're extremely well advanced in technology. And then at the other end, they have a lot of people who are very marginalized. So I'm very glad they're taking such a great interest in this area. That will be great.
Before we wrap up, is there any advance in primary healthcare to the relationship between healthcare levels 1, 2, 3 and disease predictions?
If Amado can respond, that'd be great. He's a medical doctor.
Yes, it is certainly we are now getting into a deeper level of knowledge on how can we really take advantage of all these improvements into the quantum physics in deliver or deploy at the healthcare sector. And I am confident that through this kind of groups and this kind of discussions, more joint solutions will come up and show us which will be the best way for us to go as a group. We are all coming from the civil society, and we are also looking forward how to collaborate all together. And certainly my perspective will be that in the next time we will see more collaboration in this regard, and as this example of the Open Quantum Institute that was mentioned before, some other examples will arise. I think this is the kind of initiatives and the level of exposure that we do have to bring all these matters together in order for us to make an impact. Thank you.
Thank you, Amado. That's exactly what it is. We have this great opportunity here to manage the risks going forward. And I think with AI as well, as we found, the earlier we start, the deeper discussions we can have and the better formulation, best practices. That's wonderful. We really appreciate all the people who got together. Nicolas, really, Amado, João, we couldn't do it without you, who got together to do this. Jenny, thank you so much. Oscar, thank you so much for joining us and sharing your views. And it has been a very rich session. I really appreciate your giving us your time and your thoughts and your comments. And hopefully we will continue these conversations, because quantum is going to be with us. And the better we are at delivering quantum solutions, the better for the UN and better for all of us globally. So thank you very much. And I think we're going to see in healthcare some of the first great innovations. There's a lot of money being put into healthcare as well. And that will, of course, then lead on to other innovations as well. So thank you so very much for coming and joining us.